So young people, come out, get your vaccine, get in the raffle, and try to win a full scholarship. But get the vaccine anyway because it's just smart. And we're still watching COVID. It would be irresponsible and reckless not to be wary and vigilant about COVID. There are new variants. The Delta variant they're watching now spreads much more quickly than the original virus code. It's in the United States, didn't start in the United States, but one thing COVID showed us again is how small the world is. It's not like the old days. Well, that's happening in Europe. It has nothing to do with us. That's in China. It has nothing to do with us. No. What happens in China tomorrow is our problem today and the week after. They get on a plane. It's here. Well, COVID was in China. Yeah, COVID was in China for 24 hours. And then COVID was in Europe. And 24 hours later, COVID was in New York. That's what happened here. Well, COVID's in China. By the time they were saying COVID, it was in China. It was already in Europe. And then it was in France, Spain, Italy. They got on a plane. They landed at JFK. Why did New York have that high vaccination, the high infection rate all of a sudden? Because it had been coming from Europe for weeks and weeks and weeks, and nobody knew. What a mistake. So, stay wary, stay vigilant. The Delta variant, the virus mutates all the time. There are hundreds of mutations of this virus. Right now, they say the vaccinations manage all of the mutations. But God forbid there's a mutation that the vaccination doesn't work, right? Then we're right back to zero. And, not to be the bearer of bad news, but to be the bearer of common sense, there will be another virus. There will be a next one. We don't have the luxury of saying, well, COVID, we managed. That's it. Never happen again. It will happen again. And we have to be prepared. But the emergency is over. The state of emergency that I had declared in consultation with Commissioner Zucker, a health emergency, it expires tomorrow. It will not be renewed. It will punctuate the expiration of the emergency that we have been in because New Yorkers rallied and essential workers rallied. Let's give everyone a round of applause. The emergency is over. The CDC guidance still stays in effect. The CDC mask requirement for unvaccinated individuals, public transportation, homeless settings, certain institutions, and local governments may continue, and I would urge them to continue to enforce those mask requirements where they are in effect. But in this new post-COVID period, we go down two tracks simultaneously. One, reimagine, rebuild, and renew New York. Everyone talks about just rebuilding. I don't want to just rebuild New York. I don't want to say that we went through this whole last year and rebuilding suggests you're going to go back to where you were the day before COVID started and reestablish where you were the day before COVID started. I don't want to go back to last year. Life is not about going back. Life is about going forward. And we've learned a lot since last year. We've learned many lessons during COVID. So we're not going to just rebuild. We're going to reimagine New York. What did we learn? And now we're going to reconstruct. And how do we reconstruct it better than ever before? How do we use this moment of rebuilding and reconstruction to reimagine New York? We've gotten billions of dollars from the federal government. I don't want to just replace what was. What should have been, right? We have a storm, Hurricane Sandy, your house gets knocked down. You don't rebuild the house the same way it was. You put in a better kitchen. You put in a better bathroom. You put in a better heating system. You put in solar panels. You use the opportunity to reimagine and to renew. And that's what we're doing in New York. New airports, new transportation systems, new Long Island Railroad, new broadband access. So every family now has access. New healthcare procedures. Because look how much we learned about our healthcare system and how we were not ready for the emergency. Learn those lessons and incorporate them. Governmental, societally, also personally. New Yorkers, get a vaccine and get on with life. Get out of the house. Go experience New York. Go to a movie. Go to Radio City Music Hall. See a concert. Go root for the Islanders, especially tonight. They have to win tonight. Go tonight. Root for the Islanders. Go to a restaurant. Go shopping. What people do is a major factor in bringing the economy back quickly. I'm going to go shopping. I need new ties. I think I've been wearing this tie about 10 times over the past year. Go out. Live life. Life was not about what we were doing the past year. We were surviving the past year. We were surviving. Life is about thriving. Go reconnect. Enjoy life. That's the first thing. 2, learn the lessons from COVID. Learn the lessons from COVID. COVID knocked us on our rear end. Things happen. Life will knock you on your rear end. You'll make a mistake. Something will happen outside of your control. Somebody gets sick. You lose your job. You get divorced. Something will happen in life that just knocks you on your rear. The question becomes, what do you do when you get knocked flat on your back? What do you do? And that defines you in life. That moment defines you in life. You're watching a boxing match and the guy gets knocked down. And the crowd all leans forward. What is he going to do? What is she going to do? Are they going to get up? Are they going to get up, or they're just going to lay there? And are they going to get up and they're going to be smarter for it and say, I'm not going to let that happen again. I felt it, it hurt, but I'm going to learn the lesson. We're going to learn the lessons from COVID. Part of it is our healthcare system, being able to handle an emergency, doing it safely, being prepared, being equipped. Remember what we went through when COVID started? We had to set up the largest field hospital in the country in Javits, 2,500 emergency beds. Our hospital system was going to be overwhelmed. Every expert came in and said, you're going to need at least 150,000 hospital beds, Governor. 150,000 hospital beds. You know how many hospital beds we have in this state? 50,000. Well, you're going to need 150,000 in 2 to 3 weeks. That's what I was told. Thank God we had the essential heroes that we have. Thank God the state worked together. So the upstate hospitals supported the downstate hospitals, Long Island hospitals supported. But we were on the brink of catastrophe and chaos. Don't underestimate the lesson of COVID. We were right on the cusp of total chaos. That hospital system becomes overwhelmed, like Italy, by the way, at the time. And now you have people dying in hallways. You have ambulances don't come because they have nowhere to bring you. That, my friends, was chaos. And I feel that deep inside me because we were that close. Learn those lessons now and correct those lessons now. We couldn't get vaccines. We couldn't get the Q-tip swabs to administer the vaccine. You couldn't get masks. We ran out of masks. We had to send private planes to China to buy masks from China. Masks that we were paying 70 cents per mask, we were paying $7 per mask and having to get them from China. We didn't have the right medicines. We ran out of supplies. We didn't have PPE. Nurses were going out there to work with garbage bags over them. Garbage bags as PPE. How could that happen? United States of America. New York. Federal government was nowhere to be found. They were, you're on your own, New York. Call us when it's over. What did we have? We had essential workers who did the superhuman. Essential workers is a new term. We made up the term essential workers. There was no such thing as essential workers. If I could do it over again, I'd come up with a better term than essential workers, because essential workers is sort of a blah term. What does it mean to be an essential worker? Essential workers were those people who had to show up to work to keep society functioning. Essential workers were those people who had to show up so everybody else could stay home and be safe. Governor puts the state on lockdown. Everybody has to stay home. Not everybody. The essential workers have to show up. What does that mean? Because staying home only works if the lights come on and if there's heat and if when you go to the store there's food on the shelves and if when you go to the store there are supplies so that you can stay at home. Staying at home only works if, God forbid, you get sick. You call 911, somebody answers the phone, and an ambulance comes, and it takes you to a hospital. And in the hospital, there's a doctor, and there's a nurse, and there's a staff worker. So staying home isn't that easy. For society to stay home, a lot of people have to show up and break their rear end. For you to stay home safe, a lot of people have to put their lives in danger and drive the bus and drive the train and be exposed to hundreds of people in this time of fear and chaos. Yeah, for the people who stay home, they say, oh, it was very hard to stay home. Forget you, it was hard to stay home. How about the people who I made go to work? And I took it personally. Look at the inconsistency. Everybody stay home to be safe. But not you, bus driver. You have to drive that bus so the nurse can get to work. Not you, nurse, not you, doctor, not you, teacher, not you, utility worker, not you, National Guard. You're coming out. And then you have to worry that you don't get sick, and then you have to worry that you don't get sick and bring it home to your family. One thing, if you get sick, God forbid you bring it home to your children and your wife. Is it on my clothes? Is it on my hands? Am I infected? And you have to live with that fear. That's why essential workers doesn't do it justice. These were people who went above and beyond. By the way, not the millionaires in society, not the highest paid people in society, but now the most important workers in society. And they rose to the occasion over and over. I've said thank you many times, but thank yous are a little hollow, right? So I work at ways to show thank you, because if you're really thankful, do something. It's nice that you say it. It's even more relevant if you do something to show your gratitude, to show the service. And I believe the essential workers are heroes in the truest sense of the word. We had heroes after 9/11. We have heroes after COVID. A lot of similarities between 9/11 and COVID. Different emergencies, different tragedies, but both were moments where people had to step forward and find their better selves. And people did. And in COVID, they had to do it for a year. So part of saying thank you is the honor. Part of it is making sure it doesn't happen again and we learn the lessons of the past. This Labor Day, 2021, a couple of months, New York State is going to open the Circle of Heroes Monument to essential workers. I'm going to call it the Circle of Heroes. Maybe we drop essential workers by the time we get to Labor Day. Circle of Heroes. Circle of Heroes Monument was designed by representatives of the essential workers. It is a monument of 19 maple trees in a circle, and a path in a circle, recognizing the individual responsibility and contribution of each group, but a circle representing that they were all connected, because it only worked if all the pieces worked. It only works if the ambulance shows up, and if the doctor shows up, and if the nurse shows up, and if the utility worker shows up, and if the National Guard shows up. If that circle is broken at any spot, it all falls. So the circle, but still the individual contribution of the 19 groups. In the middle of the circle will be an eternal flame that honors those that we lost during COVID. And the eternal flame says, your spirit is still alive in us and in our soul, and we will never forget, and we are eternally grateful for what you did. We are eternally grateful. This is going to be located in Battery Park City. That was the location that was picked by the Essential Worker Commission. It will be within view of the Statue of Liberty and New York Harbor. It will be right on the Hudson River. It will be a beautiful, beautiful location. And it will have the Circle of Heroes Monument. It will have an atmosphere of peace and contemplation, where people can come and remember those who were lost. People can remember this moment in time and what it represents. And it will be our way of saying thank you. There'll be a quote that was done in a story by a great New York reporter who passed away during this period. Jim Dwyer, voice of New York, voice of the working men and women of New York for many years. And he wrote, "In times to come, when we are all gone, people not yet born will walk in the sunshine of their own days because of what women and men did at this hour to feed the sick, to heal, and to comfort." Truer words were never spoken. And I think that sums up in many ways what COVID was all about. So we're going to have the monument. It's going to be done on Labor Day. How can it only be done in a couple of months? Kelly Cummings has promised me that it will get done in a couple of months, or she will be a new resident of Idaho. That's how this will work. So I believe she will get it done. We're going to have the monument. We're also going to announce $25 million in child care scholarships to the essential workers, which will extend the support for the working families that we provided during the CARES Act. That does deserve a round of applause. And while we'll never know the full number of people who have been sacrificed, we will learn the lessons, so no one has to go through this again. You know, when you think back, COVID was not the first time we had this warning. And we had warnings, and we didn't heed the warnings. But when you look back, this country cannot say, what a surprise. You had the avian flu, you had SARS, you had swine flu, you had MERS, you had Ebola, you had Zika, you had dengue. Warning after warning after warning after warning. Everybody missed it every time. It's fascinating. There was a movie in 2011 called Contagion, which was done right after Mars and SARS, which could have been a movie done about COVID. And it was done 10 years ago. And it said a bat in China transfers a virus, it gets eaten, one person gets it in China, they get on the plane, they come to the United States, everybody misses it, it moves faster than the World Health Organization, moves faster than the CDC. 10 years ago, the movie predicted everything. We didn't learn. We didn't listen. Denial. We're in denial. Let's deny it. So much easier to deny a problem in life, you know. Because if you admit the problem, then you actually have to do something about it. Well, we're going to do something about it because COVID was not the last time. And we owe it to our essential workers and to what we went through to learn the lessons. And we'll do it before there is a next time. Healthcare facilities and the staff will be on the front lines again, and they're going to be better prepared. And they're going to be better equipped, and they're going to be better trained. Society itself is going to have a new appreciation for public health. The Department of Health is going to be a different Department of Health with more of an emergency response. And we're starting with real measures today. Today I'm going to sign into law the safe staffing bills, which I believe is a major step forward in improving the quality of health care in our healthcare facilities. And what it says is plan now for how to provide for a health care system going forward. Put everyone at the table, especially the people who are on the front lines, because they know best. But the nurses, the administrators, the staffers who provide the direct care, how many people do you need to safely provide direct care to treat the patients and to keep the nurses and administrators healthy and safe? Come up with that plan, come up with it by January 1, and then the Department of Health is going to police and regulate those plans to make sure they are implemented and to penalize any violations. We want to thank the nurses for putting it together, represented by NISNA and CWA. We want to thank the healthcare workers and 1199. We want to thank 1199 and CWA for coming together as part of this effort with NISNA. And we want to thank the hospitals and Greater New York Hospital Association. This is the first time we've done this. It was hard, but we did it. And we're going to sign the bill, and we're going to take a step forward today. Congratulations to everyone who worked so hard to make this a reality. I know it was hard, but New York is better for it, and your members are better for it, and the healthcare system in this state is the better for it, and we got it done. Congratulations. Let's sign the bill. Why don't you pull in?
Pulling it.
Okay.
Pull it in.
Oh,
Let me help you.
Let's get let's get cozy.
Let's get close. Let me get a head start. You think it's easy to sign a bill? No. Nothing is easy. Signing pen means every pen was used in the signing of the bill. Congratulations, the bill is signed.
Thank you.
Thank you, sir.
Pleasure. Pleasure.
One for Eileen.
Pleasure. Eileen.
Good thing you don't have a really long name.
Yeah, I know. Sometimes I just do Andy. Who didn't get one? There you go. Sir? Okay, one more. Thank you very much. Let's give them a round of applause. I'm going to ask Eileen Gunther to say a few words, please.
Well, thank you.
Assembly member.
This pen means an awful lot to me. It's 12 years that I've worked on this bill, and I have to thank you because it means so much to me. It means so much to all of my colleagues. I'm still an RN. I'm one of you, and I want to thank you for your service during this awful virus. And this is something that you brought home to all of us, and we'll never, ever forget you for this. And all I can say is that I want to thank all of the staff that work with me, Dana and everybody, because it meant a lot. And here we are today, men and women. I worked all during COVID. I was giving out immunizations. I couldn't be prouder to work with you side by side for the last 40 years. And this is our moment, and thank you for this moment.
Thank you. Thank you for making it possible. Thank you.
Thank you all.
Thank you. Congratulations and the essential workers on Labor Day. We're going to see you at the opening of the Circle of Heroes right at Battery Park City. God bless you for what you did. Thank you. Well done. Thank you, guys. Thank you. Good to see you. Thank you very much. Let's take a couple of questions.
Governor, is there any you could respond to the mayoral results? Eric Adams is certainly in the lead. Do you think the lead will hold? And what does it say, assuming he does hold it, about where the electorate is right now?
Well, I don't. Eric Adams is in the lead. Congratulations to him at this point. Now, of course, you have this whole ranked voting system, and the Board of Elections has to do the final tally. I don't know well enough how this works and what the numbers people say. But I think, in general, electing a new mayor is very, very positive for the city. We're trying to get the city back up and running. Confidence in the mayor is very, very important. Confidence in the leadership of the mayor. And the competence of the mayor is very, very important. And I think with a new mayor, you're going to see both an increase in the confidence in leadership and increase in the competence of the management of New York City. And I think that is going to be a major, major plus. We are trying to increase optimism. We're trying to increase confidence in New York. Open your business, go back to your office, go to restaurants. New York is coming back. We're building new buildings, getting the esprit de corps up again. We have a major crime problem in New York City. That cannot be over-politicized. That is not a rhetorical problem. That is a real-life issue for the people of New York. And I think having a new mayor who has addressed it honestly and has the competence to do something about it is going to be key. I think law and order and public safety, job one. Job one. Well, bring the economy back. The economy doesn't come back if people don't feel safe. Well, bring back those people who left New York during COVID. The people won't come back unless New York is safe. Get people back into offices. That's how we're going to get people back into the restaurants. And people will not get on the subways if they think the subways are not safe. Before you get to economic rejuvenation, public safety is job one. I can do all the improvements I want to Penn Station and LaGuardia, new roads, new bridges, new attractions, new Pier 76, so much to experience. I'm afraid to go out. None of it matters. And that is real. And that is a difficult problem because you do have to reform public safety. You do have to reimagine policing. I invited every government to do it across the state that had a police force. They all did it, otherwise they wouldn't have gotten additional funds. But I don't think the plan in New York City, for example, was anything near the scope of what you need. I think it was better than nothing, but only better than nothing. And it is it's a difficult issue. You have people on one side saying, I don't trust the police to fund the police. You have the police on the other side saying, I can't do my job without trust and respect. And I'm not going to do my job if I don't think there's any safe way to do it. That has to be reconciled. That's not easy. But it has to be done as a sine qua non. And I think that's what you saw in this mayoral election. I think the voters, as usual, are smarter than the analysts. I don't think the voters watch Twitter the way the analysts do. I think the analysts and the political pundits talk to each other on Twitter, and then the voters say, yeah, but I'm out here living my life. And in my life, crime is a major issue. And fear of getting on a subway is a major issue. And I think that's what you saw the voters saying. And the lack of competence in the administration of the city is a major issue. So I think the voters were looking for two components: confidence in leadership and competence in administration. Confidence in leadership, competence in administration. But you need both. Well, this person's showed management competence. By the way, there were many people in the race who showed management competence. Sean Donovan, if you want to look at a governmental resume, I worked with him at HUD. He ran a housing agency, a federal agency, which is almost the size of small cities. Head of OMB. Ray McGuire, if you want private sector qualifications, right? So you had a lot of, Ms. Garcia ran a city agency. So you had management confidence, but you also have to have confidence in leadership, where when people hear you and look at you, they believe you can do it, and they are confident that you can do it. You need both. And that's what they look for. It's not just enough to be competent. They want competent, but they want confidence in your leadership. And I think Eric Adams, being a former police officer, says ipso facto he has experience dealing with crime. Well, how do you know? Because he was a police officer. He knows the political system because he's been borough president. He knows the needs of the community, culturally, professionally. So I think he represented a combination of confidence in leadership and competent management on the pressing issue of the day, public safety, combined with quality of life. The homeless problem is not just a homeless problem anymore. It's a public safety problem. It's not just homeless affecting quality of life. It's people being afraid that homeless affects their public safety. Issue on the subways is not just homeless people and the quality of life of the conditions. People are afraid that some of the homeless people are violent. So that is now merged, more so than in the past, as a public safety issue. And I have never really seen before homelessness be considered a public safety issue, but it is more than ever before. So that's what I think. But in general, a new mayor is going to be good. You know that the people of this city don't have confidence in this current mayor because they say it in poll after poll after poll. So I think a new mayor and that new confidence at a time when we're asking them to be confident and to invest in the city and come out, I think that's important. But I don't know what it means. Eric Adams won big. What happens with ranked choice voting, I have no idea.
What about the opposite message, though, in someplace like Buffalo? I mean, does it seem like the outcome is the polar opposite? You seem to have a newcomer, someone with DSA credentials, challenging an incumbent who's been there a long time, who has the competency of leadership. I mean, do you derive the opposite message from that, what the voters are saying there?
Well, you have to do two things, Zach. You're looking for a macro, one-size-fits-all analysis. You're not going to get a one-size-fits-all analysis. You look at New York City, which is probably the biggest test case just because you have the most voters participating, et cetera. And I think you see clear statements about the overall political mood, right? You look at the city council races, you look at Eric Adams and Ms. Garcia and Mr. Yang, et cetera, add up all those votes. But you're going to have anomalies also. Buffalo was a different situation, super low turnout. Mayor Brown, who I know very well, and I have nothing but good things to say about Mayor Brown, but he decided basically his campaign strategy, as I understand it, was basically to avoid engaging in a campaign. And then you had a very low turnout. We know that combination. We've seen that before. That doesn't work. Avoiding the campaign, this isn't really happening, doesn't work. And then you wind up with a very low turnout, and the only people who vote are the people who are organized by the opponent, right? We've seen that movie before. So you can have anomalies to a general overall current, you know. Even on a national, you'll see the states, the nation move more Democratic, or the nation move more Republican. But you'll see certain states that are anomalies. Why? Because in that race, there were specifics that counteracted the overall flow.
Governor, what do you think the incoming mayor, or how should the incoming mayor approach his or her relationship with you so it's better than the current relationship with this mayor?
The relationship will be better by definition. You know, I have worked with multiple mayors, frankly, all my life. When my father was governor, he worked with Mayor Koch, he worked with Mayor Dinkins. I was involved in those relationships. He worked with Mayor Giuliani. I was involved with those relationships. I worked with Mayor Bloomberg. I work with mayors all across the state, Democrats, Republicans, etc. I think Eric Adams I have a good relationship with Eric Adams. I know him. He was in Albany. We worked together. Andrew Yang, I have a casual relationship with, but a good one. Ms. Garcia, I don't know, but she just seems like a professional. Again, there are hundreds of mayors in New York. I work with all of them. It's hard for me to work with an administration that is hyper-political and is not competent. And it's hard to do that for a prolonged period of time. And I believe that's what happened with New York City. We need to get things done. We need results. And I need a competent partner in local government. And I understand politics. But when you are a mayor, when you are a governor, it's different than being a legislator or a public advocate. You have to get things done. You know, legislator, you express your opinion on issues and you try to pass legislation. A lot of offices, you express opinions. Yeah, but then you become an executive and you have to get things done. The government has to work. All those gears have to turn. And if they don't, then there are no results. And that's bad for the people of the city, but the people of the city are the people of the state, right? So that affects my constituents as much as the city.
Based on the fractured relationship that you had with the mayor, how do you think that impacted the government and the governance and the way the city was run and affected people who live here?
The state performed more, faster than ever before within the city. COVID management was done by the state by law, and we're very pleased about how that worked. The city was only responsible for opening schools, really, in COVID. That was their legal responsibility. We left that to the local school districts across the state. That didn't go well, but that was the city's responsibility. That's the one major task I left to the cities. And then COVID management was done by the state. Beyond that, you look at what the state is responsible for versus the city. State does Port Authority, airports. The Port Authority has never been doing more in New York City than it is now, and never been doing better. More education aid, more aid in the budget than ever before, more state police in New York City than ever before. Rebuilding of the roads and the bridges, the Long Island Railroad, Penn Station, more than ever before. Pier 76, more than ever before. So the state has done more than ever before. Any city's jurisdiction is primarily police, fire, sanitation, and education under state regulation. Those are the city's primary responsibility, whether it's New York City or it's Buffalo or Rochester or Syracuse. Police, fire, sanitation, education under state regulation in New York City with mayoral control. And I think in New York City, crime is the major problem. Homeless is a crime social service problem, which is exclusively New York City. Fire, I don't know. And on the education, the school reopening, I think it was confusing and start and stop for the parents of New York City. I think that's what the parents of New York City say. So it's not my opinion I'm offering you. It is the opinion of the people of New York City. But that matters, Pete, because those are the people who are going to decide the future of New York City.
But the fact is, when this thing started, you and the mayor couldn't agree on the appropriateness of a shutdown. Should we close the city down? And there was a delay. Do you think that cost lives?
No. It wasn't up legally. This is what you, I think, just never accepted. There are laws. The law said the state decides. Buffalo doesn't decide. Rochester doesn't decide. Syracuse doesn't decide. New York City didn't decide. The state made the decision. Well, Republican mayors said it shouldn't be closed. Yes, Republican mayors argued that I closed when I didn't need to close. Some Democratic mayors wanted to close more quickly. Yes, some Democratic mayors wanted to close more quickly. Closing as a political statement is easy. Closing as a governmental statement, Pete, and policy is much harder. Okay, everybody stay home. Well, where do the children go? Oh, I don't know. Well, did you talk to the nurses and the doctors and the food workers and all the essential workers to make sure they'll continue to work if you do a close down? Oh, well, do we have a way to pay people if they don't show up and go to work? Oh, well, did we decide which businesses have to continue to operate? Oh, so the political statement of we should close down quickly, yeah, that's easy. The governmental policy of closing down was much harder. You close down, Pete, but you're not ready to close down. That's when people die. Let's take one more. Yes.
Governor, you mentioned that you had worked with Eric Adams before. What's your most successful partnership you've had with Adams? He's been the state senator, a borough president, and what's the least successful?
I know Eric very well. We worked, he was in the Senate together. We did a lot of work together on many budgets, many bills for many years. So we worked on many issues together, and we did it personally. Borough president, obviously, is a different relationship. Governor, borough president, it's more of a social ceremonial when he was doing events, etc. I don't know if we had any specific initiatives as borough president that we worked on.
But you would say you have a positive relationship with?
Yeah. Oh, no, I like him very much. We have a good personal relationship, good professional relationship. I think he's a competent individual. I think he is an individual that will instill confidence, and I think he is a person who will step up and show real leadership, especially on the issue of crime and quality of life, which will take political courage, because it is not a political win for anyone. You know, there's X% want to defund the police. X% say we want more police on the subways, etc. Well, how do you make everyone happy is what a politician is thinking. You can't. So you know what a politician does? They stay away. They stay away. It's a no-win politically, so they stay away. Yeah, except you can't do that if you're a serious government official, because doing nothing is the worst thing that you can do. And that's what has happened here. Okay, thank you, guys.